Welcome back to the morning show on Tobago Updates Television. We're coming to you live from the Magdalena Garage and God in Land. It's Christmas in a way. I knew we begin with our guest. We are speaking with Dr. Nathaniel Duke. He is the medical chief of staff of the TRHA. It's World AIDS Day. And so we're going to be talking a little bit about that this morning. We're talking about the statistics in Tobago and the developments as it relates to treating and dealing with AIDS and HIV. Good morning, Dr. Duke, and welcome.
Good morning, good morning.
Right, it's always a pleasure to have you on our show to give us updates, information, and education as it relates to things in the health sector, wearing the cap that you wear.
Thank you, thank you.
Right, so we're talking about World AIDS Day, and we're talking about the statistics and the developments around in Tobago as it relates to the virus HIV and AIDS.
Okay, so World AIDS Day has been around for about 25 years now. And this year, in the Tobago context, well, let's look at the national context, the country, through the Ministry of Health and also of the Prime Minister, is recognizing World AIDS Day. So nationally, it is estimated that we have between 14 to 15,000 patients in Trinidad and Tobago with HIV nationally. In the Tobago context, we have approximately 500 patients in treatment and care. Now, that's who you have captured in treatment and care. And obviously, when you extrapolate that based on the amount of positive results that we have had over a period of time, it is estimated that Tobago should have about 1,000 to 1,200 patients who are HIV positive. So there is a segment of patients based on the data that have not presented themselves for treatment and care.
Wow, and this is something that we should be concerned about.
It's always concerning that you have a segment of your infected population that are not seeking treatment and care, and that's nationally and globally.
Right.
All right. So that problem exists. In the national arena, we also have that issue where a substantive amount of the patients are not presenting themselves to the treatment sites in Trinidad.
I mean, I know there's a stigma that relates to HIV and AIDS, but we need to have these people in care and treatment so that, one, they can preserve their lives, and two, protection for the lives of others who are not yet infected. So how do we capture these people to make sure that they're inside of treatment and care?
Well, it has to be a multidisciplinary approach. The healthcare system, what I would say, is more or less the end of that. So you must have your community-based organizations, your NGOs, the work environment as well. So you must look at it from the point of view of a national strategy. How do you advocate to get these individuals into some form of counseling? And when you understand their psychosocial issues, then they can move on to treatment and care, because a lot of time there's a mental barrier. There's a mental barrier to treatment, and there's also what is taking place in the home and the whole domestic issue. And so you have to strip away at those layers before you can actually get the patient to recognize that they need some form of treatment. A lot of people still do not understand HIV. They just don't.
And that is where public education comes in. I think it's important that we have an intense public education drive, not just for people who are suffering with the disease, but also for the general public to have an idea. So one, that the stigma can be broken, and two, you can have a better understanding so that we can be more caring for these people, for their needs, for their, as you said, their psychological situations and stuff like that, so we can get that level of support. So in your view, what kind of public education is being done or should be done right now to start breaking those type of barriers, not just for patients or persons carrying this disease, but for the general public?
A couple of years ago, there was a program we know, and one of the things that we wanted to do over the years was to look at know your status. And the know your status drive built on the whole issue of ramping up testing. But in doing so, yes, we would capture a lot of people who would come to be tested. And then we went on to universal testing. So now in the Tobago space, you can walk into any healthcare, any health center, emergency room, or whatever, and you can ask for an HIV test to be done. So that's one. In terms of the education, now there have been so much educational campaigns throughout the world and nationally. But what we need to do in Tobago is more or less ramp it up, reinforce, because the generational gaps have now widened.
That's right.
And we need to actually meet the younger ones at their level, from the primary schools, build into the high schools, and into the tertiary level care. All right. So we have a lot more work to do. We have done a lot of work in treatment. Now we have to now look at prevention. So there's a treatment arm and a prevention arm, and we have to really work hard on the prevention arm.
Yeah, and I think also the public education, I think it needs to be something that is very consistent.
And robust.
That's right. It can't just be a seasonal thing. It has to be consistent so that, as you say, we do the prevention aspect, because, you know, they always say prevention is better than cure. It's easier to, when you prevent it, than having to now think of how do I care for this and bring a cure for this.
Yes.
So, you know, it's very important that we do the public education drive. I mean, of course, behavioral, we have to have behavioral changes in our lives as well. You want to speak to that as well?
When you look at our culture, the culture of Trinidad and Tobago, so we have a unique culture where wine and jam, and we have a nice festive culture as well, and that probably breeds into some of the spikes that we see at certain times of the year. Now, what we should do in terms of behavior modification, which is very hard.
Yes.
That's a very, very hard thing to change human behavior. We really have to meet individuals one-on-one, right? And drill down and eliminate all of these, the myths that they have in their head, right? And once you can do that, and that takes skill, and that takes a particular skill set from the healthcare provider. A particular type of training has to be done where you can now meet people on their space rather than having them coming to meet you on your turf. Right? So that is where we actually need to go in the framework to really capture more, and also and provide you with the tests right there.
Right, and that's a lot of groundwork, a lot of footwork. You're literally going into communities, going into homes, going into, you know, in these areas where people are to get this done. And where are you right now at TRHA, where the care for HIV and AIDS is concerned? I mean, I know you said we have 500 patients in the Tobago space who have been treated and cared for, but in terms of caring and the consistency and stuff like that, are people turning up for care? Do you have to, how is that rolled out?
Okay, so HIV treatment and care has been offered in Tobago for more than 20 years. And throughout that whole time, the process has been refined and re-refined and re-refined. So the treatment sites, we have the Tobago Health Promotion Clinic, and we have this the hospital. But as I said, you can access testing at any of the healthcare centers. Now, in terms of the medications, this country has done a very good job at ensuring that the medications are provided, the antiretrovirals. We do have access to PEPFAR, which is a Presidential Emergency Release Fund for the acquisition of antiretrovirals through the U.S. Embassy. So we have been working with PEPFAR for a long time in order to get the appropriate drugs in. So the drugs are here, and because the drugs are here, the drugs have made a significant impact with respect to decreasing death, right? So those who access care, your mortality significantly decreases because now we can control the virus, now your immune system will be appropriately reconstituted, all right? And then treatment, we always say, treatment leads to decreased transmission, significantly decreased transmission, right? So the aim is to get everyone who is infected into a treatment protocol. And that is easier said than done.
We know this.
Yes.
Right? You know, I'm really happy that we're having this conversation now, because I really want people to understand that the stigma behind anything, as a matter of fact, is what keeps us back.
Yes.
So once we break those barriers and we lift those stigmas, then we're able to move forward, community as a society to rebuild the broken, and for us to live comfortably with each other. Because I know for a fact that people live with this virus. They survive and they thrive once they are in treatment. So I want you to go and advocate for people now to get into treatment, to get tested, and to get the necessary care and treatment that is available. So I'm leaving this in your hands now.
Okay. Yeah, so we the physicians are the end part of all of this. To the public, it is very, very important to know your status. The emergency rooms now have universal testing that is anonymous. So it is now part of your regular blood test. All right, you come to the emergency room and it's a part of the whole battery of tests that one can order. With that now, if something do arise, then we do have the mechanisms to provide you with pre-test counseling and post-test counseling. So we're just not going to just give you a result and cause that traumatic shock. There have been an extensive amount of work done with respect to confidentiality. We take that very seriously, confidentiality. And in so doing, when you are ready psychologically and socially to get into the treatment protocol, we guide you and we stay with you along the way. So there are specialized pharmacists, we have specialized physicians just to deal with this aspect. And remember that HIV is now classified as a chronic infectious disease. So just like how we have chronic non-communicable disease, this is a chronic infectious disease that we are to treat, just like your diabetes and hypertension, we are to treat as part of your wellness.
Thank you very much, Dr. Nathaniel Duke, there, Medical Chief of Staff of the Tobago Regional Health Authority, bringing us some statistics and developments as it relates to HIV/AIDS in Trinidad and Tobago, specifically in the Tobago space. Know your stats. Yes, it is very important that we do. All right, ladies and gentlemen, we always want to say thank you for choosing the morning show on Tobago Updates Television. We really appreciate when you view with us. We thank you for your comments. We thank you for your feedback. We thank you for your love. And right now, we're going to take a short break before we come back with conversations with our next guest. And in the meantime, this is your opportunity to share the live, share the live, share the live. We'll be back.